Do you have number 3? Yeah, MSC 3?
Can I see on your monitor? Thank you.
Yes.
Thank you.
You want to see the patient or the... this is the patient's part, okay. So you want to... do you want to read this part?
Doctor. Yes,
The
we are
the
a doctor,
doctor
patient.
part. Okay.
Often have asked you to go to the patient house to teach him about how to take insulin injection.
Okay.
Okay, I am ready.
You're ready. Okay. Uh, okay, let's go. Hello,
It
doctor.
is patient home.
Yes. Uh,
Uh,
yeah, it's a home visit. You have come to my home.
yes. Hello. Nice to see you. My name is Dr. One of the doctors in the clinic, and I have come to see you in your home. But how can I help you today?
Well, doctor, I think you you need to say that you have come to tell me about injections, okay? Right. Yes, doctor. So I don't understand why I need injections because my diabetes is well controlled and it's not too bad actually. Um,
Mm-hmm.
so I don't know. I don't like injections. You know me.
Yes, I can totally understand your concern. But first, before we go further, I would like to ask you some question, if you don't mind.
No problem. Yes.
I would like to know about your diabetes. When it start? When did it start?
It's I think 20 something, maybe 25 years.
25 years. You mean you have this problem from 25 years ago?
That's
Is that
right.
right?
Yes.
And what medication did you use in this
Um,
time?
well, I had metformin, I had glycoside, and I had pioglitazone,
Mm-hmm.
aspirin, Lipitor, and something for my blood pressure. I think it was Ramipril or something like that.
Yes, and I would like to know about your glucose level. Have you checked your glucose level recently?
Well, I check it in the morning, and if it's okay, then I have a good breakfast. And sometimes I check it at night as well because I want to see if I should eat well. Um, yeah, if the sugar level is good, then I eat a good dinner.
Mm-hmm. After checking the level of glucose, yes?
That's right.
Okay, and you mean that you checked every day your glucose level
Yeah, twice usually. Yeah, I check it,
twice?
and if I go for a party or something, then I check it again to make sure I can eat enough.
Mm-hmm. That's good that you check your blood glucose level regularly. Okay,
Okay.
and I want to know about your other medical history. Do you have any other problem like diabetes, like hypertension or heart disease?
Yeah, my blood pressure is high. No, I didn't have any heart disease.
Mm-hmm. Your blood pressure, you have hypertension, me.
Yeah, it's well, hypertension. Is that the high blood pressure?
Yes, high blood pressure.
Yes,
I mean
yes, that
high
is.
blood pressure.
Yes.
And please tell me, do you have you taken any medication for hypertension?
Yeah, I take Ramipril. I told you. Yes.
And is it controlled?
Yeah, it's good. It's okay.
It's
Yeah.
good. Okay, and please tell me about your drinking and smoking. Do you drink? Do you smoke?
No.
No, no drinking, no smoking. And what about the diabetes in your family? Have you had this problem in your family history?
Well, my family. Yeah, my aunt had diabetes, and my maternal cousin, and one of the yeah, my grandmother as well.
Okay, yes. Okay, now see if I have understood currently your detailed information. You have diabetes. You have had diabetes from 25 years ago, and you take some medication for it. And it is, and you check your diet, your glucose level regularly, about twice a day. And after that, you eat good, and you don't drink, don't smoke, and you have hypertension, and you take some medication for your hypertension, and it is under control, and that's it. Is that right?
Yes.
Okay, now I want to know about your other problem, your eye, your kidney. Is that okay? Your kidneys, your eyes.
Yeah,
Do
I
you
have
have?
regular checks. They're okay. Yes.
They are okay. Okay. About the insulin. Um, what um, what is your main problem? تمام شد.
I don't have any problem. What is your problem?
Okay,
You can't tell a patient what is your problem.
your problem. Yes,
No, that's not good. You cannot say what's your problem. What is your concern? What are you
yes,
worried about? Is there anything that concerns you? Okay.
yes.
Um, right. Okay. Well, you carry on. Just carry on for 1 minute to tell me what to do with yeah. Uh, well, doctor, I think that my diabetes is well managed with my diet and tablets. So why do I need injections?
I can totally understand your concern, but let me tell you that because you have had diabetes for 25 year, and it is not enough for you to use only medication, only tablet. Am I clear? Do you understand? Do you? Is that right?
But how do you know that, doctor? How do you know that it's not enough?
Because I think you eat so much after you checking your blood level.
Okay. So does that mean I shouldn't?
I think after you should check your blood level glucose after eating, not before eating. I am clear.
Okay.
Am I clear for you?
Okay. You sound very angry, doctor.
No, I have. I don't have so much time because
If you say, "Am
my
I clear?" it's
am I?
that is very angry.
Yes.
Okay. All right. So, doctor, uh, what should I do for the injection?
For the injection, let me tell you that the injection is very easy process for you, and I can teach you very easily. We have some injector that you don't need um, to hurt yourself. Self-injection insulin can be challenging at first, but we can train you in a training program that we have in our hospital. Do you
Okay.
think can you participate in this training process?
Yes, I think I can.
Yes, we can teach you in the process step by step, and help you gain confidence in this situation.
Okay. Thank you, doctor.
Would you like me to make an appointment for you?
No, I will call later. Thank you, doctor.
Okay, okay.
All right. Thank you.
Thank
Okay,
you. Wow.
right. So, well, yes. Well, how did you feel?
I don't know.
You don't know.
No.
Why?
I don't know because I don't have much time. I think I asked so much question. Yes. I don't know.
Okay. So, what is your feeling? Do you feel happy? Do you feel not happy, or
Happy. Exactly.
you feel happy?
Yes. I
Okay.
think I did good, but I don't have much time.
Okay. So you feeling happy.
Yes.
What went well? What did you do well?
Gathering information, summarizing, signposting, I think,
Mm,
and chunking and checking, I think.
signposting and chunking and checking. Okay. Okay. Good. What could you do differently?
Manage time, I think.
Okay. Time management. What do you mean?
My time was over after question gathering information.
Okay. Right. Why did that happen?
I think I asked so many questions, but I feel it was necessary about questioning family history, drinking, drunk. I don't know.
Okay. Did you have any repetition?
Repetition. You mean echoing?
No, not echoing. I mean, did you repeat a few questions or a few facts or a few uh, parts of the consultation?
I don't think so.
You don't think so? Okay.
No.
So what else could be done differently?
Time managing.
Oh, you said that.
Yes. I don't know.
We don't know.
Yes.
Okay. Let's hear from others. Who's after? Uh, yep. Who is that?
I think I am.
Yes.
I
Okay.
think.
Yes. Okay.
Yeah.
What do you think?
I think there are some uh, points that should be noticed about that. For example, she f- for example, patients worried about the insulin and necessity of insulin injection.
Okay.
But Dr. Susan doesn't answer and explain about why the necessity of insulin injection.
Okay. Explore and address the concern. Okay.
Yes.
Okay.
And she waste her time to information gathering, and she couldn't have time to teach the injection and how to uh, inject the insulin and something like that.
Okay. Okay.
For
So
example, information giving is, for example, is not good.
yeah. Okay. What else?
And I don't remember she show empathy to the patient's concerns and something like that.
Uh, right. Did she show any empathy? Mm, okay. Uh, right. I can't remember anything. Okay. Anybody else? Uh,
I think was weak in building a relationship, and also she was weak in following eyes, idea, concern, and expectation.
Okay. So exploring ideas, concerns,
Yes,
expectation.
yes, and it means, I think it means the structure was weak.
Okay. So okay.
And
Uh,
uh, and the final matter is, as Wessel said, is related to empathy.
okay. All right. Thank you. So who's next?
Doctor, I think that was great if the task was about to doctor was supposed to decide if the patient needs starting the insulin, but and I mean great, she was great in questioning, in gathering information, and
Right.
she fulfill all of the criteria. But
Okay.
I think it's better to see the situation, the task, and to be. I think gathering information is enough until to reach to the point that then he or she need the injection, and then go through the tasks.
Okay.
Yes.
So you mean to save time for other tasks? Okay. Well,
Yes. Yes.
actually, we don't have to finish the task, but obviously, if you don't give any information, that means that you're going to.
You have missed 3 points. Yes, you have
That's right.
she missed 3 points of giving information.
That's right. Yes.
Mhm.
So you need to at least give a small piece of information before the consultation stops. Okay. So uh, basically, if you think it is you are nearly at the end of the consultation, you have to hurry up and you have to just give some information. You should say, okay, um, basically, what I'm going to do is to show you how to do the injections. Is that okay? And he says, okay, okay. So the first thing you need to do this and that. Patients are usually, I mean, the simulated patients are not obstructive. They're not, they don't try to trouble you like in other examinations. In medical examinations, they might actually cause you trouble and say, well, no, I first want you to convince me that I need an injection. And then you get stuck. So you have to convince them. But in this exam, it's not like that. If you say, right, now I'm going to tell you how to inject, the patient says, okay, tell me.
Okay. I think doctor, she asked several repeated questions because you mentioned about the rampil
Yeah.
that she takes, but again she asked about this, and also the most concern of the patient was how to inject the insulin to herself, and he change and she know about diabetes. It doesn't need to take speak detail about the diabetes
Mm,
diabetes.
right. Right. So, in other words,
Uh,
in
s-
yes.
Sorry, I forgot something like told that a lot of jargon, for example, hypertension, and she um, insists on repetition of hypertension or something the medical terminology. I don't remember. She used another word,
Okay.
as glucose, for example. She should mm, talk sugar, not glucose. I think the
Okay.
patient didn't know about glucose.
Okay. Right. Um, okay. Thank you. Now, I tell you what. The problem with targeted consultation is that you don't have much time. So we say time is luxury. So in a hospital, you can ask so many questions, but not in a targeted consultation. Uh, so in targeted consultation, you need to be very focused. Okay, you need to focus on the task. Um, so basically, you asked about family history of diabetes. Is that important? Is that relevant?
No, no, no.
Okay, so social history, yes, smoking and drinking is important, but actually, we usually know the patient. I mean, you've gone to the patient's home to tell him how to inject. So you normally know this patient. It's the patient at your practice. You have their history. So you don't actually need to go so much through the past medical history. So basically what you said, and you asked, what medicines are you taking? We don't actually need that. It's basically you need to say, okay, I know that you're taking so many medicines, but they're not controlling your sugar. Uh, so now, what is the what I can suggest that could be a better approach to this patient? You just go there and say, hi or hello, Mr. I don't know, Johnson, and I'm here today to tell you how to inject. Okay, and the patient says, well, I don't want injections. I think my sugar is well controlled. Now, how can you tell a patient that their sugar is not well controlled?
Based on complication that she has.
Uh, by hemoglobin A1C.
Blood glucose.
Okay. And normally the patients call that a 3-month sugar level. Okay. You say your 3-month sugar level or the 3-month test. Okay. It actually it is 6 weeks, but usually we say 3 months test. So um, basically, we can say that based on your 3-month sugar level, your diabetes is not well controlled, and that's why the tablets you're taking are not enough. This means that the sugar, extra sugar, is going to hurt your vital organs like your kidneys, your eyes, your heart, your brain. Okay, so basically, we need an objective reason that he needs injections. So. So what is next? The best thing is to say, so why do you think, what are you concerned with? Why do you think you don't need injections? Then the patient obviously says, well, because at first they're saying, well, I think my sugar is well controlled, but then they say, well, I think it's very difficult. Then you have to reassure them and say, well, look, it is not that difficult that you think, and it's going to be easy. And as time goes, you get used to it and that sort of thing. Okay. About summarizing, I was happy with the summarizing. The type of information gathering was okay, but it wasn't targeted. I think you asked a lot of questions that were not necessary, like what do you think for hypertension? And I actually said it earlier. I said Ramipril. Also, yeah, so about the family history. So you could save some time there. Exploring the ideas, concerns, expectations is the most important part that you missed. You could actually ask, so what is it that you are worried about? Okay, and you said, what is your problem? Please do not use this word. Do not use problem. What is your problem is offensive. It's people say that on the street when they want to fight. Okay, like the colored people here say, yeah, what's your problem, man? Why are you looking at me? What's your problem? Okay. Also, yeah. Am I clear? It is also offensive. It's usually teachers tell students, just sit down and do your homework and don't say a word. Am I clear? Okay. So basically, you need to be careful with these because the usage is not appropriate in OET examination. They are not professional language. They're not normal language. They're actually offensive. So don't say that. What is your problem, or am I clear? No. Sometimes they say something they use. The English use very often. They say, "Okay, are you with me? Is that okay? Are you with me? Okay. Are you with me? It means that do you understand me? Okay. Also, yeah, instead of saying what is your problem, you can say what seems to be the problem. And so, or what seems to be your worry, or what is your concern? So, what seems to be the problem here? Okay, this is very different from what is your problem. Okay, we don't want this. Okay, this is too bad. Or for example, you are talking to someone and you say, do we have a problem here? It means, are we going to fight? Right? So we don't say that. Okay, so are you with me? Yeah.
Yes, yes.
Okay. So yeah, so the setting is very important. The setting tells you that you're going to a patient's home to tell them how to inject insulin. So you know this patient, you have spoken to them before. It is arranged. So it's not the first time you're seeing this patient, definitely. And so you don't actually need to introduce yourself to ask the patient's name. You just go there and say, hello, Mr. Johnson, and I'm here to tell you about the injections today. And how are you? How do you feel? And the patient then says that, well, I'm really worried. I'm not happy. I think my sugar is well controlled. And then you take it from there and you say, you start to explore why the patient thinks the sugar is okay. Is it because they're not aware, or is it because they're trying to ignore it or to avoid the injection? Then objective, you say objectively that your 3-month sugar level is high, so you need to go on injections. If you don't, what happens with the complications? How much do you know about the complications? And then you can say, well, okay, so summarize and say, wait, so we need to do the injections. And I understand, you show your empathy, I understand it must be hard. It's not easy at the beginning, but I'm sure you will get used to it, and this is for your own good. Hypertension and medical jargon. Yeah, well, you can say high blood pressure. Why did you say hypertension? And you repeated that. Maybe because you were nervous. Yeah, you said from 25 years ago, and then you said for 25 years later, which is that the second one is better. We just say for 25 years. We don't say from 25 years ago. And to eat well, not to eat good. And do you think can you? No. Do you think you can? So it's as a suggestion because I know at the intermediate level you might get confused with double questions. So don't use those. Do you think? Do you think I can make you an appointment, or do you think you said something? Do you think can you do something? Do you think you can do something? If it's difficult, if it's confusing, just don't say do you think. Just say can you do this? Okay. It's it is a little bit more difficult. So do you think you can? Do you remember what you said?
No, actually.
No. Do you think you can make an appointment, or do you think you can go to the hospital? Do you think you can go to this course? Do you think you can go to the hospital? Okay. And you said, do you think can you go to the hospital? So, yeah, you use both question forms. Okay. So, generally speaking, we want more targeted consultation. You need to be aware of the setting. That is very important. So, what is the setting? Think about it. You have 3 minutes in real exam. It means where you are and who, what kind of doctor, and who the patient is, who the doctor is, what is the setting, and when is it. Okay. So then you will have a better idea. You need to imagine yourself in that situation. You need to imagine, okay, I'm going to a patient's home. What I'm going to tell him? I'm going to say, hello, Mr. Someone, because you cannot just go to someone's house without telling them. So you have spoken to them. You have arranged this. You go there and say, oh, hello, Mr. Johnson, I'm here today to discuss your injections. Is that okay? How are you? What do you want to know? What would you like to know? Okay.
Sorry, excuse me. You mean that there is no need any gathering information?
Yes, we want to gather information, but what information? The information we want to gather is not family history, or is not how many years the patient has had diabetes. The information we need to gather is, okay, I'm here to do this. I'm here to tell you how to inject insulin, and so we talked about it before. Okay, do you have any questions? Okay, so you gather information from here. You start gathering information from, okay, he says, no, I think my diabetes is well controlled. And then you ask questions. Why do you think it is well controlled? And he might say, why do you think it's not well controlled? You say, well, because of HbA1c. Right, okay. And so what happens if the sugar level is not well controlled? What do you think would happen? Do you have any idea? Have you had any trouble? And well, um, we don't actually need to say how many times a day you check your blood sugar because it's not important, basically.
Yes.
The HbA1c is what matters. Even if you check your sugar 10 times a day, it doesn't make any difference. So, what I'm saying is look at the setting and then you understand where to start. I'm not saying you shouldn't gather information. Yes, you need to gather relevant information, relevant to that setting. And if you are a GP, if you're going to patients' home, it's definitely you have definitely spoken to them and arranged this, and you know the patient, you know the background, so you don't have to go through how many years you have had diabetes or family history, social history, that sort of thing. You just start from there. Is that okay?
Yes, thank you.
Okay.